Hello, everyone, and welcome back to my channel, The Practical Therapist. Today, we will answer the question, what is an SLP? Some of you listening may have heard the term before, and some of you may have not, but today we will dive into this topic a little deeper. So here are some common terms that you will hear. Speech teacher. Parents of school-age children have probably heard this term from their child or while attending an IEP meeting in the school. Speech therapist. This is a term that many parents become familiar with if they have been given a referral from their child's pediatrician. In my years of practice, I have come across several parents that have told me that they didn't even know what a speech therapist was initially until it became clear that their child was not talking yet and they needed help. SLP. This is an interchangeable term that has been used for school therapists and therapists that work in the medical side of speech, for example, in your private practices, hospitals, nursing homes, etc. But for the remainder of this video, I will use the term SLP. So now that you know some of these terms, let's talk about exactly what an SLP does. So if you look at the definition here on your slide, ASHA, or the American Speech Language Hearing Association, as it is also known, has provided the definition for what a speech therapist is. I'm going to give you a few seconds to read it, and then I'll continue on. So you can see from this definition that a speech language pathologist, or SLP for short, encompasses more than just someone who helps a child say the S sound or helps someone who is stuttering. As professionals, our scope of practice allows us to diagnose and treat a wide range of various delays and disabilities. The next slide will break down the 4 common areas diagnosed and treated by a speech language pathologist. So, for the purpose of this video, however, we will focus on how these 4 common areas can negatively affect your child and what you can do as a parent to seek the proper professional or professionals for help. So now we're going to discuss these 4 common areas treated by SLPs. First up, dysphagia. Dysphagia is generally defined as difficulty swallowing food and or liquids. Dysphagia can be congenital, meaning present at birth, or acquired, the result of injury or damage to the nerves and muscles that control eating, chewing, and swallowing. Some of the first indications of dysphagia in a young child may be problems such as latching onto a nipple or bottle, refusal of food, acid reflux, and recurrent bouts of pneumonia. In extremely severe cases, children are put on a G-tube or other type of tube to minimize the development of pneumonia while still allowing the child to access nutrition by by bypassing the oral structures, such as the mouth and esophagus, and delivering nutrition directly to the stomach. Next, we have speech. A speech disorder is an impairment of the articulation of speech sounds or difficulty with stuttering. Oftentimes, children who have had a history of ear infections or PE tubes will have problems with speech and pronunciation. Some children may also have close family members that experienced similar problems. Parents have also reported to me that either they or another closely related adult family member has had speech therapy as a child to correct articulation and pronunciation problems. Third, we have language. A language disorder is impaired comprehension and or use of spoken, written, and or symbol systems. Many parents become concerned when their child is between 18 months and 2 years old and have not yet begun to talk. In my 16 years of practice, I wrote this when I was 15 years in, but now it's been 16 years. So in my 16 years of practice, especially working with the Babies Can't Wait and early intervention programs, this is the most common referral from pediatricians and the most common concern from most parents. So if your child is between 2 and 2.5 years old and has not begun to use verbal language to communicate, but chooses to point to what they want or use other gestures, a referral to an SLP is warranted. However, make sure that your child has passed a recent hearing screening or test to rule out any possible hearing problems first. Last, let's discuss voice. A voice disorder is characterized by the abnormal production and or absences of vocal quality, pitch, loudness, resonance, and or duration, which is inappropriate for an individual's age and or sex or gender. Although voice disorders can be treated in children, most SLPs treat voice disorders in adults. For example, an adult who may have sustained damage to their voice due to their profession, which causes them to use their voice excessively. An example of this would be a singer who has strained his or her vocal cords, or a teacher who works in a loud classroom. However, I want parents to know that differences in a child's voice, such as abnormal pitch, a raspy or breathy voice, or a voice that sounds robotic or flat, can be indications of other underlying conditions. Any concerns or changes that you observe with your child's voice can be brought up in conversations with your pediatrician. For example, if your child's voice has changed from normal sounding for his or her age and gender to raspy over time, this could be an indication of acid reflux or gastrointestinal reflux, or GERD as it is also known. Oftentimes, children who suffer regularly from bouts of acid reflux can develop a hoarse or raspy voice, and that can have a negative impact on their ability to be understood clearly. That was a lot of information. So, now what? In conclusion, I discussed in more detail the four common areas treated by SLPs because I believe as a parent, arming yourself with more knowledge allows for better conversations and outcomes with your child's pediatrician. This also allows you to seek help from other professionals, such as an SLP that may be critical in getting your child the therapy that he or she needs. This concludes this video today. Thank you for tuning in. Be sure to like, share, and subscribe. Make sure to click the notification bell so that you get my next video. I'll talk to you soon.